Hello, welcome back to my channel. My name is Mari, and this is going to be the CT Registry CQR review. If this is your first time watching this video or watching my presentations, I have been doing the CT Registry review for ARRT, and you can also use this for your CQR because I'm using the same outline. In this section, we are going over the pelvis. In the last video, I covered the abdomen and the anatomy for the abdomen. So for this topic or this presentation, we're going to talk about different pathology related to the pelvis without contrast, pelvis with, different type of infections and inflammation. And I want to ask you, did you all have any questions on the last lesson, the abdomen? Are you all okay with starting IVs? I have plenty of venipuncture videos on my channel. You can look at the playlist, and if you're not comfortable with starting IVs, you can kind of get an idea of how to do it. So this is just the anatomy of your pelvis. Just make sure you know it. Just make sure you know everything on this picture, and then also just match it up to a CT image whenever you are at work. Make sure that you're able to pick it out. And then more anatomy, because if someone ordered, like if a doctor ordered a pelvis exam, you want to make sure that you're not clipping the iliac crest, the pelvis, the femoral, and lesser trochanter. So you just want to make sure that you know your anatomy so that you're not clipping anything. Say doctor order a CT pelvis scan. It could be to check for pelvic cancer. It could be to check for to see if the cancer has spread to the pelvic area, especially if it started in the liver, kidney, pancreas, another area other than the pelvic area. If a patient was in a car accident or had some type of trauma, you can do a bony pelvis as a CT scan as well. So it's different pathology a CT pelvis will look for. Just make sure that you are checking the order to see if it's ordered with contrast or if it's ordered without contrast. And then this is the anatomy that you should know for a female pelvis. Know how to find it on a CT image. You also want to know that the uterus is in between the bladder and rectum. So just make sure you know your anatomy and where to find it. You have your layers of the uterine wall. Know these layers, know how to find it on a CT image, or know which layer is considered the outer layer, which layer is the middle layer, things like that. And then the reason for a CT female pelvis, it could be used to evaluate that pelvic pain, to see what type of staging a patient is in, if they have some type of pelvic cancer or cancer in their pelvic area. And also on CT scans, especially if it is given with contrast and you're doing the abdomen and pelvis or just a pelvis scan, you are able to notice a fibroid. I'm not sure if y'all all know what it is, but it's like a benign tumor in the uterus. Sometimes patients don't know that they have fibroids. Sometimes they may have like a bulging stomach or back pain, pelvic pain, a lot of heavy bleeding. And one day they may go in for an abdomen pain, and then on their scan, it reveals that they have a large fibroid or they have small fibroids. And then you also have your ovarian cysts. And you have different type of cancers of the uterus. You have your cervical, uterine, ovarian cancer. So just make sure you know your female pelvis anatomy as well. And you also have different scans that is performed in CT. I normally perform the CT Enterography and CT virtual colonoscopy a lot at my clinic. But depending on where you work at, you may perform all of these. You may not perform them at all. So you just have different protocols you have to follow. My biggest thing is making sure that you have the correct patient before you give them that oral contrast or that iodine, make sure they are not allergic. And also know that the oral contrast does have iodine in it. Before you give them the contrast, make sure that you have the correct patient, the correct order, you're doing the correct exam. So just make sure that you read this information. Is just going to give you steps on how to perform these exams, about how much contrast you will need, about how fast you can go. And I always say just follow what your company's protocol is regarding these scans. You have your CT enterography. Whenever you are scanning this, if you are unsure if you have enough contrast in the pelvic area, or if you are unsure if the exam is going to come out right because maybe the patient could not tolerate drinking all of the contrast, contact the radiologist and see if they want you to tell the patient to keep drinking or to stop drinking, because if they vomit most of their contrast up, you want to know how good is the scan going to be. So you can always call the radiologist. They're very helpful with answering any question that you may have. And whenever you have a patient come in for a CT colonography, you are pretty much injecting air into their rectum so that their colon can fill up with air. So you normally do about 50 to 80 pumps. When you get closer to, I would say, about 60 to 70 pumps, the patient may start feeling a little bit uncomfortable. So you may have a patient who can't tolerate 80 pumps. You may have a patient who can tolerate 100 pumps. So just go by your patient and how much they can tolerate, especially the air. You want to make sure that you are using gel and lube it with a lubricant for the tubing that you have to put in the rectum, because you want to make sure that you're not scoring them down there. And there are different positions the patient have to lie in. They have to lay decubitus position, supine, prone. It's different positions that they have to roll over on, and make sure that the tube does not come out whenever they are rolling over. And make sure they do not fall off the table as well. It's very important to let the patient know. Be careful, be right there beside them whenever you are having them turn over, because the table is so narrow, you do not want them to fall off. They will have a bowel prep they have to follow before they do come in. Maybe the scheduling team or their doctor will give them that prep. They have to follow that facilities protocol on what to drink, what not to eat, what not to drink on the days leading up to the CT exam. This is an example of how it will look, how the patient go to the restroom before you start. They can go to the restroom afterwards too. Always provide a towel, cleaning wipes, because it can get messy. Whenever you are injecting that air, close the blinds for the CT room in case someone is walking by so that they do not see the patient exposed. Make sure that they have followed the prep. Once you get started, if you do not think you have enough air on the scalp, check with the radiologist, see if everything is coming out right. Even before they leave, especially if they drive a long ways, if they are maybe elderly, or maybe if they're not elderly but can't get away or can't get around as often because maybe they can't drive or they do not have a vehicle, you can ask the radiologist to view the pictures, and then they'll just make sure everything is okay. Um, and at the clinic that I work at, there aren't a lot of cystograms being performed. They do come in, so I will say if you see a cystogram, just write it down, see how much contrast you're using, know which part of the Foley catheter you're supposed to inject the contrast in, know that you can hang the contrast from like an IV pole so that it can go inside of the patient's Foley catheter correctly. And I would say just take notes. It's not a hard scan to do, but if you see one in January and don't see one until November, then you may forget the steps or you may need a little help. So I would say just take notes and so you can know how to do it if you see one come in. Know the signs and the symptoms if someone has colorectal cancer. And then also know how to look for it on the CT image, even though we're not actually diagnosing a patient. It's just good to know your anatomy and know what you're looking at and what you're looking for and what symptoms to watch out just for your health's sake as well. And this is the end of this presentation. I appreciate you all for watching. If you find that this video is helpful to you, could you please give it a thumbs up? If you would like to leave any comments, any feedback, you are more than welcome to. And I thank you all for watching. Stay tuned for the next lesson. And if you have any other topics that you want me to cover, whether it's a topic or a lesson related to CT, or if you want me to cover another modality in radiology once I'm done with all of the CT lesson, let me know. If you want me to put up review questions for you, could you please put in a comment if you would like review questions for these lessons? Well, thank you so much for watching, and I hope you enjoyed this presentation.